it's crazy, but it's
You're watching Channel Z, the world's leading zombie apocalypse channel, broadcasting live from Studio Z.
Makes me act the way I do.
Welcome to the Channel Z show. I'm Athena Aktipis, and I am joined by Dr. Z.
Hi, everybody. I'm Dr. Z, aka Joe Alcock, MD.
Welcome to our show today. We're really excited to have a Q&A with Dr. Z and several of his zombie medicine colleagues, right, Joe?
That's right. So today I'm coming at you from the Dr. Z HQ here in the foothills of the Sandia Mountains in New Mexico. And I have many of my colleagues, some of my coworkers, who are wilderness medicine experts, also here in New Mexico, who are going to join us today. And in particular, we have a lot of talent today, including Dr. Jake Jensen. Jake is a product of our UNM fellowship in wilderness and austere and international medicine. He is an expert in wilderness medicine. He is also an alumnus of the first zombie apocalypse medical meeting, which we had 2 years ago at Arizona State University. But his travels have taken him all over the world. He's been to Haiti, Nepal, many other remote and austere locales in extreme environments. He knows quite a lot about bites, injuries, and you name it. So Jake, say hello.
Yeah, thanks for having me on. It's great to join you guys and see you again.
Yeah. And before we really kind of jump into this, as I mentioned, we're blessed to have a rich and talented group of people with us today. We also have Risa Garcia, MD. Risa is another graduate of our University of New Mexico Fellowship in Wilderness, International, and Austere Medicine. She's done research on ultramarathon and extreme endurance events. She's an expert in many things, including wilderness medicine topics of all sorts. So welcome, Risa.
Thanks for having me.
And we also have Annaleigh Boggess, MD. She is our current University of New Mexico Wilderness Medicine Fellow. She is a well-trained and expert emergency physician, gaining a lot of expertise and renown for her interest in wilderness medicine. So thank you, Annaleigh.
Thanks.
And we should at some point have Daryl Macias, who's wrapping up a little wilderness adventure this morning. We'll see if we get him on the phone call too. But I kind of want to start with you, Jake, because you put on a really remarkable scenario during the ZAM conference, the Zombie Apocalypse Medical Meeting Conference that we had. You showed us how to remove a limb and what the techniques were if you had to do a field amputation after a bite. And again, just for the viewing audience, I want people to know that we're talking about some real physics, real medicine, real biology, real important stuff. But before you attempt to do a field amputation, I would encourage you to please consult your own physician, your own zombie expert before you were to do something that's on your own. So with that caveat, Jake, why don't you tell us a little bit about what you did and what you showed us during that zombie meeting 2 years ago?
Yeah, I mean, if you wanted, did you want to jump right to the amputation or talk about some of the other stuff first?
You know what? This is, we have time to talk about the other stuff.
All right. So, I mean, so at the inaugural ZAM conference, myself and Clint Kalin, who's one of our physician's assistants, we had a really good time doing kind of an introduction to basic wound care and medical kits. And as Joe stated, we kind of set up a scenario where you're in Phoenix driving up towards the Grand Canyon. And as you left, chaos was breaking loose, and you got near the canyon, and we kind of went over medical kits and kind of the need to have items in a medical kit. And it's hard for those that haven't had medical training to know what might be the most important item. For me, if you're someone that has medical conditions and you rely on medications, those are going to quickly climb to the top of the list to ensure that you have the medications that you need to be healthy and as long of a supply as you can take. But apart from that, we discussed kind of what are the most common types of injuries that you might have to treat in any austere wilderness post, kind of apocalypse type setting. And we determined that kind of common wound care was probably going to be one of the more commonly things that one might encounter. And so when it comes to wound care, there's a lot that goes into the evaluation, treatment, and management, far more than we could cover in the short time here. But what it comes down to is it comes down to an evaluation of the wound, seeing how large it is it superficial, is it very deep? And then we talked about kind of more complex wounds. Those would be those that enter into joint spaces or maybe injure some of your tendons that you might have in your, predominantly in your arms. But the main concepts of wound care are that any wound should be cleaned. And there's many ways that you can go about cleaning a wound. Fortunately,
Jake, I'm going to jump in here because we already have some questions from the audience that I think are quite relevant to what you're talking about now. Erica O'Neill, she is asking about maggots. Are maggots a good thing in my wound? I've heard they're used in medicine to clean out wounds. What are your thoughts on maggots in wounds?
Great question.
Yeah, so maggots, that's kind of a mixed bag. I mean, I've seen in the emergency department, I've seen people come in with fairly clean wounds that had maggots on them, and we just kind of removed the maggots and did a little bit of debridement. That's kind of cutting away dead infected tissue, and that's kind of what they thrive on. So while they might be able to help out, clean up some of that non-viable or dying tissue, in reality, in my mind, they're a sign that there is something bad going on and that more care than maggots is needed. I know when I was in Haiti once after one of the hurricanes, there was a guy who had come up who had already had a prior partial amputation of his foot, and he showed up with a high temperature. He was tachycardic, meaning a fast heart rate. He was septic, and looking at his wound, it was full of maggots. But in addition to those maggots, it was full of a lot of dead tissue, kind of gangrenous tissue. And basically, the clinic I was at, we were ill prepared to perform any further amputations on this guy. And so basically what we did is we removed the maggots in an effort to find this dead, non-viable infected tissue, gave him antibiotics, removed it as best we could, and then we put a nice clean dressing on there and sent him on his way to the hospital up the road. So, I mean, they might, for me, maggots, I think they're an indication that there's something bad going on. And while they might clean up some of the dead tissue, they won't fully address the problem, as oftentimes antibiotics and further debridement or removal of that tissue is needed.
That's a great question. And I think before we, I wanted to bring in.
Sorry, Dr. Zed. Erica has a follow-up question here. Whether she can become a zombie if maggots bite a zombie and then bite her. I don't know if she's asking for a friend or asking for herself, but.
So we're talking about a zombie vector from a maggot. It's entirely possible. We don't really know exactly how a novel zombie virus is transmitted. And that poses, I think, that one of the biggest problems for how we're going to approach patients and possible victims. How we're going to deal with wounds, for instance, if we don't know the effect of how much someone poses a risk to us. So yeah, maybe the maggots themselves could be a vector for disease. That's entirely possible. Looks like we also
unless they're wearing masks.
We have Daryl Macias in the backstage here. Daryl is a very well-known. He's trained many of the folks that we have on this call in wilderness, austere, and remote medicine. Just wanted to kind of bring him onto the onto this discussion.
He is not on at the moment, and I think Pam has another follow-up maybe you could address in the meantime while we're waiting for him. She's asking if do maggots eat gangrenous tissue, since we're on the topic of maggots.
Yeah, so Jake talked about removing debrided. There we go. I think we got Daryl now. Using maggots potentially, if you didn't have means of debriding tissue or you didn't have antibiotics, maggots might potentially actually be useful. They certainly have been used to clean wounds medically. In addition to something that we'd have to do to removing insect larvae from a wound as part of basic wound care. Hi, Daryl. It looks like you're there.
So I don't actually see Daryl on my end of the call here. I'm not sure what's going on. Do you see him?
You know what? Daryl's still on the Zoom call. We need to get Daryl onto the StreamYard link. And I texted that link to you, Daryl. Let's try that in a little bit.
We have a question from Charlotte here in the meantime. She woke up this morning with a red round swelling on her leg. She noticed a few spiders in the corner, but also noticed her neighbors were walking funny out of their house. How can I tell if it's a zombie bite or a spider bite? So how to tell the difference between a zombie bite and a spider bite?
Let's see if Annaleigh or Risa can answer that question.
Oops. All right, let's get Annaleigh and Risa on here.
In terms of identifying the bite, I think it kind of depends on how large of a bite it is. It sounds like you already have some spiders inside of your house, which is pretty indicative that that's probably the most likely culprit. So I just kind of watch and wait and make sure it doesn't get infected.
Sure, I think the appearance of the wound, whether there's bite marks as in teeth marks, spider bites are usually pretty small, maybe more punctate in appearance with then surrounding redness, more of a bump rather than seeing, if you imagined your own mouth on your arm or your limb, maybe that would be more indicative of a zombie bite.
And to piggyback off of what Risa said, I just watched the Train to Busan the other day, and exactly, zombie bites, they're going to look like a big chunk was maybe the typical zombie bite, that is kind of like a human bite. And there's usually multiple of them, not kind of a small inconspicuous one as Dr. Garcia described.
Unknown caller.
Joe, would you like to introduce?
Hey, we have Daryl Macias.
Yes.
Hold on. My car keys are on the thing. Hold on, I got a call from Paul Auerbach. Sorry.
Paul Auerbach, for those of you listening, is the author of this.
Hi, Paul. I'm on a webcast. Yeah, let's call in about an hour.
Let's Well, when Daryl gets off the phone with one of the wilderness medicine experts, truly a preeminent leader in the field.
Okay, thanks, Paul.
We'll have Daryl introduce himself, and maybe he can speak to this question about venomous bites versus a zombie bite. Hey, Daryl.
Hey, sorry about that. How are you guys doing? Just waking up. No, I'm not waking up.
But Daryl, tell us a little bit about who you are and what your background is.
I'm a foreman at McDonald's, and just last week, because of the COVID outbreak, they asked me, because I'm so talented with bugs and things like that, to work in the emergency department. So here I am. They actually promoted me to full professor at the University of New Mexico. And Joe and I have been fighting zombies for many years, and I've well, what can I say? Yeah, we're just fighting zombies every day. And I like to fight the unseen zombies. Those are my favorite. And of course, Jake and Annaleigh and Risa have also drank the Kool-Aid of zombie and zombification. So we're excited to be here. But I actually started a wilderness medicine program several years ago at UNM. And at any rate, it started to just grab hold in so many programs, and now we're doing something called Wildernational Medicine. So we take our educational things out into not only the wilderness, but internationally. So thanks for having me, Dr. Zed.
Thanks. I wanted to follow up a little bit on the previous question. There was a question about maggots. There was a question about spider bites and venomous bites. What do you think about using heat or vinegar on an unknown wound? And do you think that that might actually work for zombie bites? And do you know why I'm asking the question?
Yeah, in a way I do. First of all, I think if you're talking about heat, in zombie lore at least, the heat expels all the evil humors. If you believe in evil humors, we could discuss what evil humors are. And heat may, though, if it is a physical entity that is something that can be seen, could actually worsen, let's say, a spider bite or something like that, because it could increase inflammation. And so it could actually increase, if I understand the idea of our video cast, it could increase the idea of zombification by increasing inflammatory mediators. So I am not a proponent of heat. I'm a proponent of stopping zombies wherever they may live. And so my preferred treatment might be ice. However, if I happen to be in the ocean where there's these weird looking gelatinous zombies with nematocysts hanging off of their tentacles, then I might actually be a proponent of heat. And yes, vinegar would actually work stinging as well. A sting, yeah. Right. So those are the zombies that I would favor the treatment of heat and the treatment of vinegar. But for other zombies, I don't think so, unless you're trying to remove the odor of cat urine from your carpet. Then vinegar is excellent.
Okay, great. Jake, should we circle back and talk about amputations?
We certainly can. I mean, the topic of zombie bites was touched on, and if you watch, many of the Hollywood films, someone gets bit. What's one of the treatments they do? Hack an arm or a leg off. And it's actually interesting because at the first ZAM conference, we brought this up and we tried to find data. Like, is there anything that supports this as like a possible treatment? And going all the way back to 1972, there was an article in the Journal of Infectious Diseases by G.M. Bauer and W.F. Cleary, and it's called A Model in Mice for the Pathogenesis and Treatment of Rabies. And this article actually gave some support for this. What they did is they took the rabies, which in some people have talked about as kind of like kind of in a way like a zombie-like virus, right? It attacks the brain, the neurons, and causes people to go rabid. And so what they did is they inoculated the foot pads of these mice with the with the virus that came from the salivary gland of a rabid bobcat. So it was actually transmitted from one animal to another. And they found that if they amputated the inoculated foot or leg within 18 days, that mouse did not develop rabies, that it basically was the treatment for it. And so when we talk about zombies, there's different ideas on how quickly, whatever the vector of disease or transmission is, how quickly it would take a person over. But this actually gave some kind of credibility to the idea or thought that amputation is a potential treatment should one get a bite on an extremity that you could amputate.
Do you think dry bites might be a thing with zombies?
I'm gonna, from all the shows I've watched, I'm gonna have to say they're not like snakes, and dry bites are not a thing.
Not a thing. So we really have to worry about an actual inoculation.
Dr. Zed, for the rest of us, can you explain the difference between a dry bite and other kinds of bites?
Well, maybe we get Risa or Annaleigh to talk about snake bites and the likelihood that some snake bites may not actually deliver venom. Either of you want to jump in on that question?
Sure. So the difference between a dry bite and an inoculation bite is often if an venomous snake or even a spider does bite you, then there's there's such an opportunity is to not have any venom inoculated, and you can have a dry bite. And that kind of presents a little bit differently in terms of the amount of pain and what the bite actually looks like. And here in New Mexico, we are most familiar with rattlesnakes and rattlesnake bites here. And there's kind of a folklore that smaller snakes are more dangerous because they don't know how to limit the amount of venom that they release. But it's actually, you just don't want to get bit by snakes, and don't get bit by any rattlesnakes. In other parts of the country, there's copperhead snakes, other types of venomous snakes, and so the biggest thing with these types of snake bites, especially if you're in the apocalypse or in the wilderness, is some of the previous teaching has been to put a tourniquet on the limb or to try and cut the wound and suck out venom, and all of those things. Definitely don't try and do any of those things. A tourniquet can actually just limit where the venom goes and cause more localized tissue damage. So the best thing to do if you're bit by a snake, and probably applies to zombie bites also, is to limit the amount that you're using that limb. So if you get bit in the foot, trying not to use your foot much, and just get to medical help as soon as you can.
So Risa, would you use something like this, maybe to splint a bite or a wound? I'm showing a picture of a SAM splint.
Sure. So especially for a snake bite thing, like you said, you don't want to try to tourniquet it or suck out the venom, things like that. But splinting, especially an extremity, can be really helpful to and sort of immobilizing the wound. And sort of the thinking there is when you're immobilizing your limb, you're at least helping prevent some of the more vigorous blood flow. So for example, if your leg is in, try not to walk on it. If it's your arm, keep it elevated, and that'll help sort of slow down a little bit of the progress of the envenomation while you seek medical help. So a SAM splint or just splinting, even with sticks, gauze, you can improvise a lot of things to mobilize, to help sort of slow things down while you're looking for help, while you're cleaning the wound, etc.
So Risa, in a zombie apocalypse situation, if you get bit by a zombie, would you recommend treating it sort of potentially in this snake bite manner? I mean, what would be the key features of a bite, from a zombie that would let you know that maybe it is like a snake bite?
I think that if the bite from a zombie is similar in that it's going to cause local tissue damage, then I would treat it more like a rattlesnake bite. So we think of animal bites and rattlesnake bites as different. Rattlesnake bites, their venom actually causes disorders of the blood, of the clotting abilities of the blood, and causes a lot of damage that way. And so then you can get a lot of tissue death, necrosis, and problems with that. And as the venom travels through the body, a lot more risk of bleeding. So that's one of the things you're trying to prevent too while you're seeking help. So if the zombies have that characteristic in their bite, I would treat it as a rattlesnake bite. If their characteristics are more like other animal bites, I think local wound care cleaning, irrigation would be the first thing to do.
Yeah, this is one of the big questions that I think all of us have now, because it's not really clear, what kind of zombie apocalypse we're dealing with, whether there may very well be many different kinds of zombies, biologically speaking, that might need to be treated differently. So, Dr. Zed, maybe you can give some general advice about, like how you would tell how, like what features would make you treat it more like a animal bite? What features might make you treat it more like a snake bite or an insect bite? If you do get bitten by a zombie, what should you be looking for?
Yeah, the advice, of course, is to not panic, which is hard to do when you've been bitten by a zombie. We brought this issue of a dry bite. And it may, in fact, be, as Jake mentioned, that dry bites are not a thing for the zombie apocalypse. But we probably wouldn't want to hack off the limb right away until we do a little bit more investigation into the source of the bite and the nature of the venom, or the infectious agent. And that's going to take some research. So we need to figure out and do more work to figure out how is this zombie virus transmitted? How do we protect ourselves? And what is the best way to treat it? We've taken some insights from snake bites and from proteolytic toxins and venoms versus neurotoxins. Those can be informative. I think splinting and vigorous wound care is going to be a mainstay of any kind of wound during the zombie apocalypse. But I think in the last couple of minutes, I want to talk a little bit about how do you protect yourself. Maybe the best way is to wear some protective gear. So a bite encounters some body armor like this that protects you from a bite. And I saw that, Daryl, you were wearing a specialized mask that was used in the Middle Ages during the plague epidemic. Maybe you can speak to that question of how one could protect yourself from an apocalypse.
Yeah, and if I can just jump in here, we have actually a question from the audience that's along these lines. So it looks like Erica has gotten a splash of zombie blood on an open wound. So maybe, after talking about protection, what happens if your protection fails? Maybe you can address that as well.
Well, Jake or Daryl?
So, I mean, I think going back to start, like the principles of wound care come into cleaning any wound that may have potentially become infected by a zombie, whether that's a bite, blood, it's hard, whatever form of inoculation you can conceive in your mind. And the principles of wound care are irrigation with water. Any water that you would drink, you can irrigate the wound with. And there's various methods to irrigate the wound. Kind of the best is taking a medical syringe, filling that with water and, pressing down on that to create some pressure to irrigate the wound. If you don't have that, running it under a faucet or cutting a hole in a Ziploc bag and squeezing that on the wound. But you want to irrigate the wounds with a substantial amount of water. Typically, in the setting in the emergency department, we're irrigating many wounds with a half a liter to up to several liters, depending on the size. And so irrigation is foremost. And then after that, keeping the wound clean. At this point, it's hard to say if any bite or injury encountered secondary to a zombie, if it would be wise to suture or close. We don't know that yet. But definitely irrigation and then putting a dressing on there to keep it clean and watching for signs of infection or spread.
Great. Should we talk about protective gear now?
Daryl, how do we protect ourselves?
So let's be specific. Are you referring to does one protect oneself from a bite or from aerosols or what?
Well, we don't really know. So
Okay.
I think it's an open question.
Well, so here's the other thing. And what I noticed, Joe, you warm my heart when I see your books and you have the survival manual on there. So as some of you may or may not know, Joe and I have taught survival classes for many years. And we have taught ways and improvised ways to find water and food. And I think food is a very interesting thing to talk about. We talk about eating plants. We talk about eating animals. You have to be careful, though, with regard to the zombie land, USA or England or France, what you eat, because many of you may have heard of Creutzfeldt-Jakob disease, which is an acute spongiform encephalopathy. And those are usually garnered from maybe eating the brains of an infected animal or forbid it, a human, or even the meat. So those are extremely rare. So one of the things is you protect yourself by watching what you eat. Always watch what you eat. We also had an interesting case the other day of pig bite. We were talking about this this morning, about somebody who got bitten by a pig. Now, pigs can transmit rabies and all those sort of things, but also eating a pig can be dangerous if it's uncooked. Of course, many of you have heard of trichinella, and that can basically, that's a worm that can burrow into the muscles or brain. If you're interested in eating bear, it has the same characteristics. You can get trichinella from eating bear, and we actually had a bear bite. With regard to aerosolized protection, that's important. Another interesting case we were talking about is a couple of years ago, we took a group to Panama, to the jungles, and one of our faculty members was hit on the head by a bat. Another one of our students actually was in the room with a bat. So one of the things is, can bats transmit rabies aerosolized? There is a possibility that that can happen. Some of the recommendations are very disparate with regard to, well, should I get rabies treatment if I'm in the room with a bat? A lot of people would err on the side of caution and say yes. Some would say no. That's somewhat controversial. But if you were to be bitten by a bat, or you find a wound that you can't account for in a bat-ridden area, well, make sure that you're in a tent with lots of netting if you're in bat country and whatnot. Another interesting way to protect yourself using the net is also a combination of using mosquito repellents, because mosquitoes can bite you and they can give you some really nasty zombie types of viral diseases as well. For instance, like dengue. And I know there's a participant or two on this live cast that have had the beautiful experience of having dengue. It's something not to be fooling around. And lastly, I would like to cover COVID-19. And I did forget my COVID ball. It's in the car. But at any rate, with this sort of thing, this is a big point of contention. How do we protect ourselves? Do we protect ourselves with surgical masks? Do we protect ourselves with just, you know, something like this that we see a lot of people do? How effective is this? This is probably not very effective. So I wouldn't recommend just using a bandana. But a surgical mask may be a barrier if you happen to be one of those individuals carrying coronavirus, but it doesn't protect you if somebody's coughing in your face. So there are more, how should I say, robust types of filtering system masks, such as an N95 or an 1870. There's a variety of things out there on the market that will actually protect you. And one of the
we have a question from Dave Lundberg Kenrick about the plague masks, plague doctor masks. Would they
like
protect?
This one?
That one.
Oh, well, that's a great question. Let me tell you, do you know why this is designed the way it is? Say no.
I don't know.
Ah, all right. Well, here's the deal. So these doctors would actually wear these things, and inside of the nasal area, they would actually put a lot of these herbs, lavender and a lot of other various herbs, that was meant to be some sort of a filter and some sort of a barrier to get rid of these evil ethers that were in the air from the Black Death of the middle, like 1200s and 1300s. So actually there was some efficacy. However, we do know that this was very ineffectual compared to what we have now. The other thing that was used, if you notice on some of these pictures, is the doctors treating these people with Black Plague actually had a cane. Do you know what that cane was for?
Poking people.
Distance. It kept distance, the 6-foot distance. So they were actually onto something then. So no, I don't recommend using these medieval methods of protection, but I do highly recommend N95s or some of these other approved devices, such as full masks.
And Athena, how are we doing on time?
We need to bring it to a close. We are a bit over time, but I think we want to thank our guests for being on the call. And Joe, do you want to talk a little bit about the Zombie Apocalypse Medicine meeting while we're saying goodbye to our guests?
Yeah, so let's wrap things up. Thank you, everybody. We talked about a lot of different kinds of zombification, from parasites, from spongiform encephalopathies like you get from elk brain. We've talked about rabies. We've talked about whether these can be transmitted by blood or aerosols. We've talked about maggots, snake bites, jellyfish. So I would like to ask the audience maybe to join the chat and send us your questions or things you want to hear about next time. And then, of course, this is all in preparation for our big conference in October of this year, October 18th, 19th. I got those dates right.
15th through 18th.
15th
October
through the
18th.
of 2020.
Yeah.
Thank you for clarifying. Please do follow the links in the show notes and on this live stream to register for the conference and submit your abstracts for that conference. It's going to be a blast.
Yep, there's still time to submit your abstracts. The deadline is August 1st. So if you have any research that is related to zombies, the apocalypse, monsters in general, human health, or existential issues, you're very welcome to submit an abstract. We're accepting from all disciplines. It's a radically interdisciplinary conference and includes everything from medicine to psychology to parasitology to art. So it is, and not to mention humanities, of course, zombie studies. So do submit your abstract and join us. We'll have our ZAM meeting will be all streamed. We'll have several episodes of the Dr. Zed Show covering different topics in zombie medicine. And we have some amazing speakers lined up for ZAM 2020, including David Quammen and Sarah Hill. And you can go to the zombiemed.org website to see more about our lineup.
Great. Well, thanks. Signing off here from Dr. Zed HQ. We'll come at you next time. Bye.
Thank you for joining the Dr. Zed Show. This is Channel Zed.